Olá a todos e a todas, meu nome é Paulo Gustavo, sou professor do curso de Relações Internacionais da Universidade Federal do Amapá, aqui no Brasil, e professor do programa de pós-graduação em Estudos de Fronteira, o PPGEF. Nós fizemos essa série de entrevistas, né, com acadêmicos da região que nós temos como foco de estudo, que é a chamada região das Guianas, para justamente ouvir um pouco do que está acontecendo a respeito do Covid-19 em lugares em que não estão na mídia, né? Estou falando então do Amapá, da Guiana Francesa, do Suriname, da Guiana, de Roraima e também em lugares do Caribe, né? Então, eu espero que vocês aproveitem essa série de vídeos, divulguem. Muito obrigado.
Well, first of all, I would like to thank you, Ruben Martoredjo, to being part of this interview. The idea is to give an overview about the coronavirus in your country, Suriname. We have a lot of information, sometimes from Europe or United States and China, but from the countries in South America, especially our region, the Guyana region, we usually don't have any news. So the idea is to give an update and see the situation. No, thank you very much. I'd like first you introduce yourself to our viewers.
Yes, good day, Paulo. Thank you for the opportunity involving me in this conversation. I think it's a challenging time, and I think for everybody, including our academic society. We have been faced with a new challenge not seen or experienced before. I'm an academic. I have a PhD in international relations. I'm involved in studying social development, international relation, regional integration, specifically interested in the Guyana Shield region, being member of the Guyana Shield geographic area myself. I'm also involved in the Institute of International Relations of Anton as board member. I'm glad to be part of this conversation. I think it's important, especially for our region, as the Guyana Shield region is one that, you know, it's not really too much in the picture when it comes down to international phenomena like this one, like the pandemic that we are experiencing now. But at the same time, we have also situations where, you know, especially vulnerable communities like the indigenous and tribal communities are also vulnerable for the implications and the results of such a pandemic. So I think it's important that we really look at it from our perspective and you know, face our own realities as academics, as researchers. I think it's important for us to really reflect and, you know, do targeted research in regard to the epidemiological, but also the social and economical impact of such a pandemic to our societies. Yes, we in Suriname, we have, you know, the first case on the 13th of March, the first case that was tested positive, which is a case imported, actually somebody coming back from Europe. And I must say that the government has been very effective and taking decisive actions starting from that point. We have been sealing our borders, and that same evening, the government has advised or instructed the population to take social distancing and to stay home as much as possible. School has been closed, businesses has been adjusted immediately thereafter. So we're now living in the third week of a situation where, you know, most of the working population is staying home or work according to adjusted schedule to minimize the contact, you know, keeping in par with the instruction of social distancing, and also to minimize the spread of the virus.
How many people are infected in Suriname today, the 1st of April?
as of yesterday evening, we have 10 cases tested positive, of which I think the majority is based on contact with, with cases that has been confirmed before. We also have a more than 500 people in quarantine. Majority of them are people that has been, brought back from the different destination. Suriname, people has been all over the world in different countries when the border has been announced closed starting the evening of the 13th of March. So even in that case, the government is working if efficiently based on the availability of quarantine space and capacity. Schedules have been worked out. People have been brought back from destinations such as Miami, Brazil. Yesterday, we have a group of people that has been brought back from Brazil. I think the only place that people still has to be brought back to Suriname is Europe, the Netherlands mostly. But all in all, I think the government has done well. They have established a management team comprising of different stakeholders such as the Ministry of Health, the National Emergency Entity, headed by, the Prime Minister, who is also participating, not the Prime Minister, the Vice President, was also participating in most of the daily briefing. There's a daily briefing where the press and the public is informed through the media of the progress of the development and the measure that has been taken.
And let me have another question. One of the problems in Brazil, like to lock out people, it's because many people, they won't get their salary in the private companies, but also we have a part of our economy run by people that they are what we call informal work. And so the fights, the political fights, it's been like to make the government to pay, for just people. I would like to know the situation in Suriname.
Well, I think that's indeed, as I mentioned before, the vulnerable groups within society. That is something that me as a person, as an academic, I'm worrying about, because the pandemic will definitely going to have an impact on, besides social and health life, but also the economic life. And I think that's something that we should not underestimate. In Suriname, almost 40% of the working society is employed by the public sector, by the government. So I think that group is okay. And the government will continue to pay the salary. People has been advised, non-essential staff, for instance, has been advised to work from home, to telecommute, to work from home. So for that group of people and people that are involved in a steady employment, I think the challenge is not as high as the group, as you mentioned, active in the informal sector. Reason being that, it's necessary to avoid and to contribute to the further spread of the virus. But at the same time, people still have to have an income to stay alive, and if, especially the informal sector, if you're not going out there, you're not getting income, you don't have a salary. So that's a huge challenge also here. We're talking about people, selling goods and products in the markets, people that are doing construction work, what we call the contractors at the infrastructure, as the structure, at the buildings sector. Those are people that needs to get, in my view, extra financial support in order to, to get through this process. The challenge is also, we don't know for how long this will continue, because in fact, if we're not living at the third week in Suriname, it's now start getting there that the number is increasing. We have one on the 30th of March, and on the 1st of April we have 10. And we are still testing people to see to what extent more people are infected. So at the same time, the government's effort is really to slow down the spread so that we don't overwhelm our medical capacity.
Definitely.
You know, we have seen it in bigger countries with better medical system, like in Europe. You know, we've seen in Italy, we have seen in even the Netherlands, we have seen in Spain now, you know, with much better health system, with much more capacity in the sector, and the system is overwhelmed.
Yeah.
So I think the effort that's being made here locally is really to tone down the spread of the virus, and you know, to delay the peak so that, you know, we can adapt, adjust, and also address with our capacity, which is not easily to build up, you know, because of the challenges. Everybody is seeking the same capacity, everybody is seeking the same material, equipment, like the respiratory equipment. So it's not easy, like for smaller country like ours.
No.
And that, but that's why I think it is important for us to contribute as academic, but also as individual, to the efforts made nationally, and also help to seek opportunities, solutions in addressing especially the social economic impact to society, especially to those of the lower quintile of society, you know, the low income and people living in, you know, a part of the informal sector.
Let me have a last question on this interview. It's what as you as academic, as Surinamese that work on Caribbean and the region, what do you see for the future after this pandemic, like settle down? And do you see any big change or any challenge to the role of the state or to the role of the capitalism, or once we have the wealth to go over it, you know? But the main problems being like the sharing, not the wealth itself. Well, how do you see it?
Well, as I mentioned just now, you know, we foresee a devastating impact on the economy in most of the countries. Even for the wealthier country, we've seen the effects already, because the impact is tremendous. Beside the fact that people cannot sustain their livelihood in most cases, the industry, the production sector will be slowed down, or even become at a standstill at one point. And looking at the smaller economies, and most economies in the Caribbean, of which Suriname is also part of, it's a small economy, open, and most cases dependent on one production sector. Maybe Suriname is an exception with Guyana and Belize, because we are endowed with a lot of richness, like, you know, gold, oil, etc. But looking at the rest of the Caribbean, where most of the countries are dependent on one sector, mostly tourism. So the impact is going to be devastating for these countries. And yes, I think as a society, and especially those that are more endowed, those has more resources, I think we have to take on a level of solidarity that we have not seen before. And I think we need to share, because even though you have the riches, you have the resources, you have the financing as individual, maybe in a society, if the rest of the society is impacted, I don't think it is advisable for you to be part of that society. So I think, indeed, as you mentioned, we have to be more collaborative, more cooperative, more sharing, and I think that is something that in most of the capitalist-based society is a new dimension, right? You know, those society, and us that has been studying the more social side of societies and systems, we see that is some element that you cannot avoid in a society if you want to have a just society. But I think this is a lesson learned for the world, but also for our region, that, you know, we have to take on more of solidarity, more of a national system, you know, things like a national health security system, you know, a social system, something that, you know, I think we have to spiral that kind of discussion again For instance, if you look at how the reaction has been in countries like China, with millions of people, and how they have been able to contain, to manage, and compare that to what we are now witnessing in the US, in New York, for instance, a big capital with with a lot of richness, but they are overwhelmed now. And that's why I think we have to look at systems beyond just the democracy rhetoric, beyond the capitalist and financial rhetoric. But I think we need to look at society as a whole, as human being. I think we need to go back at the source of being a human, being a human, what it takes to be a human. And that's things like social elements, economic elements, of course, but of course, the emotional, right? Don't forget the emotional, because one of the areas that is now being discussed by different specialists is the mental health impact that this pandemic will have on society and individual. And it's an area that we could zoom in, and I think we should have a follow-up discussion on this, and looking at how we as academics can contribute, right? And also look at our own region to see to what extent that we could do some impact studies and all these kind of researches to see and help bring solutions.
After it ends, there will be a lot of data and experience, to be looking at, and many questions will rise. Well, I think our time is getting up. Well, I'd like to thank you again, Ruben. You are a partner of a very good partner of mine to work here in the region, and I hope you, your family, and your society, and we can go through it as good as we can. And thank you again for your time, and I hope to talk to you soon in a better situation.
Sure, Paulo, and also keep yourself safe, right?
Thank you
We'll talk
very
some
much.
more. Thank you.